Hello, everyone. I see it now. 12 people are already here. We would just wait 5 minutes to let all users join, and then we'll start with the webinar. Till then, for the people who are already there in the webinar, if you could introduce yourself, that would also be really good. So we have an idea, like a just short introduction, who you are, where you're from. So then I can also focus on those areas and on those topics that you're interested in. I see it. So there are a lot of interesting questions that have already come here in the chat. So the thing is, all of these questions, almost 90% of your questions, I'll answer them directly through your webinar. And at the end, we're going to have a Q&A session where Dr. Rutuja Kulkarni also joining us, and then both of us together would be answering your questions based on our experience and our current situation and all of that. So we would have kept plenty of time for everybody to get their questions answered. Like I said, so in 3 minutes, we'll just get started. You see, we have Dr. Reha from Pakistan, Dr. Talibur Rahman from India. I've read all of your messages also on Instagram, and I've also seen your emails and so on. We'll be discussing all of your topics. Dr. Subhash is also asking from China. That is one hot topic right now with a lot of debate going on here in Germany, especially about the unsurety regarding that. We'll touch on that as well. So what I'll do is now, you can see my screen. I'll start with my presentation firstly. So this webinar will focus mainly on the basic steps. How do you start your medical career in Germany? So what all process do you need? How are the documents that are required? How does it go about? Basically, what is the ground reality there? So a little introduction about myself. So I'm Dr. Faiz Sheikh. I'm a Facharzt in neurosurgery here in Germany. That means a specialist. Facharzt is a German term, which is equivalent to MCH or board certified surgeon, like you say in the US, in Germany. I did my graduation MBBS in Maharashtra in Loni from a small village. I myself come from Aurangabad, from a very small town in India. And honestly saying, I had myself never imagined that, I would come to this stage where I'll be in Germany here as a neurosurgeon when I started my MBBS in the small town called Loni. But thankfully, luck paid out. I got a lot of information during my final year, and there was a quite a bit of struggle for me to get to Germany in my initial phase, where I had issues with documents which delayed my work for up to an hour, and sorry, for up to a year. And eventually, with all of the delay in 2019, I arrived in Germany. But what I also recommend to my students is personally what I did myself. The time in India, I utilized it to learn the language really well, to learn the medical terminology really well, so that immediately as soon as I came in the same year, within 9 months, I could clear the exams and get my approbation. And within the next year, in 2020, I started my post-graduation in neurosurgery, which is 6 years here. So surgical specialties are 6 years, and non-surgical specialties are 5 years here in Germany. So in the 6 years that I had, I started in Jan 2020, and then now this Jan 2026, I completed my Facharzt, and then I cleared the exams. And when I started, there were a lot of students and there were a lot of doctors just like me struggling to start their career in Germany. And when I figured out a way, I initially with Nigel and Rutuja, we were all three of us aiming for to come to Germany, and we figured out a way to do it much better and in a much cheaper way compared to what the at that time the consultants were offering and a lot of people were saying about Germany. There were a lot of misconceptions that were told to us when we were in India, and the real ground scenario was something completely different. But that was obviously expected. The consultant that I was talking to, the educational consultant that I was caught talking to there, he was once in Germany. He's never lived here. He's never worked here. He was not even a doctor. So he could just tell me everything what I could also read on the internet. I mean, yeah, I know what are the positive points about Germany and the negative points about Germany, but what is the real scenario there? That only I realized after coming here. So after once I came here, so we started helping doctors to start their career here in Germany, and eventually we got so many questions and from so many doctors in India that we decided, okay, we'll start with MedZiel. That is when Nigel, me, and Rutu just sat down and we were like, okay, we have a lot of queries and we are busy in our work, so let's start this project alongside where we help all the doctors who are here to come to Germany. And that is how MedZiel was born. So it was started by three doctors, me, Dr. Nigel, and Dr. Rutuja. So Dr. Nigel is a Facharzt for urology here, and Dr. Rutuja Kulkarni is a dermatologist here in Germany. So we have expertise of three doctors available to you, as well as we have at least a network of 50 doctors here in all different fields, with all of them approaching the end of their post-graduation now, who also are really good friends with us, or students, or our students, and we have a lot of experience in all fields, if so to say. So what we do is obviously we guide the international medical graduates in Germany, and the thing is, it's very standardized process if you go to see UK, US, or Australia, or other foreign countries, for example. But in Germany, it is more of a person-to-person based approach. Even the authority deals every document that you give, everything that you give on a person-to-person base. So we also make your plan according to your requirements, what is your preference, and not that, okay, you should come to only this class and you should go to that class and you should live in this city and you should work there. We do not dictate the terms. You tell us the plan and we tell you, okay, how to make it happen. So it is a teamwork here that happens, and not a guideline that, okay, this is where you go and this is what you do. and we've been helping doctors all over the world from India, especially most of our doctors are from India, obviously. But we are here, when we work here, you have a multicultural team and you know about the whole process in almost a lot of countries. So today we're going to cover these 6 topics. Firstly, why Germany? What are its advantages, disadvantages, who this is for, how is the roadmap, a step-by-step approach on how to come to Germany, get your recognition, and how to start your post-graduation. So assistant arts, this is the term in German, which means postgraduate or your resident. So every time I say assistant arts, it means as a resident. The key exams that you have to clear the FSP and KP exam, and it's not just clearing the KP exam. After clearing your KP exam, you have a whole process of documents that you need to get your approbation and the whole system there. So what happens is a lot of classes, they will tell you, okay, we teach you KP and FSP, and after your KP is done, they'll be like, okay, we have done our job, tata, bye bye. But our system is we are with you throughout the whole process, not just getting you the approbation, but getting you the PG seat that you want, helping you, guiding you to get that PG seat. Obviously, we cannot give the guarantee that you will get your seat. We have a lot of contacts through them. We can recommend you to a lot of colleagues, to a lot of hospitals. At the end, obviously, it depends on your CV and how good you are, and most importantly, how good your German language is. Then we'll talk about the common mistakes to avoid, and then at the last stage, again, how MedZiel helps you. So, firstly, why Germany? So, and if you go and if you think about in any way, the most important thing that everyone thinks is how can we, just a second. So, um, so when you're going somewhere, obviously you want to know what is the scenario there, what are the positives, and most importantly, can you sustain yourself? You should, how much are you investing there, and how much are you getting a return on it? At the end of the day, you need, it's not just about being a doctor, it's about your daily life, the quality of life that you get, the services that you get, the environment that you work in. There are a lot of factors there. So first and foremost is that there is no post-graduation or tuition fees for learning in Germany. It is treated like a job. So basically, what happens is once you clear your approbation, there is a list on the medical council. There's a list of doctors who can train you. Now, these doctors are specialists who have years of experience. They're basically like HODs, head of the departments, and they are working in different hospitals, different clinics. And only if the medical council has given them permission, then they can train you in this post graduation. So that is one very, and then what happens is you apply to them, and then they will take you up as a assistant arts, and as this assistant arts, because you are working, you get paid for it, and there's no tuition. So you work and you study side by side. Now the work part, because you are working your ass off, obviously in any residency you go for, it is very competitive, it's very difficult, and there's a lot of hard work that requires to complete your residency. But honestly, I'll tell you from my personal experience, uh, on the difficult days, or especially at the end of the month, when you get a good salary, and that at least helps ease the pain, at least helps you say, okay, yeah, maybe it's not that bad, I can struggle through one more year or one more month and so on. That is what also keeps you going. Obviously, that's my personal experience. It's everybody has their own way, but that is how I personally felt. So you're, as a resident yourself, as soon as you start, you're earning from 5,000 per month. This is before taxes, and you get paid more for every hour. So overtime is paid extra. Your night shifts are paid extra. If you work on the weekends, you are paid extra, and so on. So it adds up, what I would say. Then the world-class health system. Germany is well known for their health system. So the how the hospitals and clinics here work here is quite different. So like in a hospital, what I would tell you, my day is like we go. There's a whole team meeting that we have initially, where we discuss all the cases that we have taken. There's a group of 30 neurosurgeons. Now my team is a big neurosurgery team. So we are a group of 30 neurosurgeons who are sitting and discussing those cases that have come over the last night. So you have 30 different doctors discussing and making sure that nothing is missed about this patient. And then everybody disperses into their respective areas. Some go in the operation, some are in the clinics, and some of them will be managing the emergency department, some of them in the ICU, and the rest of them in the ward. So the team disperses and get on with their work. And then again in the afternoon, everybody meets up. Again, there's a big discussion about all the cases that have been discussed today, all the new cases that we have gotten, all the new changes that have happened today, all the new x-rays, MRIs, and everything that has been done. And according to that, of the wider the plan is made for the patients, how they'll be treated, and so on. So it's a very structured day-to-day routine where every patient is discussed multiple times in a big group of doctors with different opinions, and the hierarchy system is also quite flat here. So obviously, yeah, the HOD and the level difference and the knowledge level difference obviously matters, but if you are, as you stroll on with your experience and obviously with your language, the more trust you gain of the consultants, the more say you have in your team. And here, honestly saying, my personal experience is that they really see how you are as a person and how capable you are as a doctor. They do not your skin is or what language you speak or where you are from and so on. As long as you are working good, you're a good doctor and you're communicating really well, which is the most important part, there you should have no problem at all in the system. Then coming to your career growth options. So it's not just the discussion there. Residents are every day encouraged to discuss cases, present cases. Now in my clinic, residents are expected that when a patient comes, that they have already done the diagnostics, they have already prepared everything, they have already organized the MRIs, the labs, and anything and everything that is required. Now, for example, if a brain tumor comes in, all the diagnostics that we need, the navigation MRIs and the functional MRIs and all of that are documented, are ready, and the patient is already informed about the decision that there's an operation that would be required, so that once that it is discussed in the team meeting, the resident presents it, says, okay, the operation is necessary. And depending on time limit, we also discuss how is the operation going to be, when is the operation going to be, and what are the steps. Now I'm talking from a surgical point of view. So as a surgery resident, I was expected that I would say, okay, how do we take out the tumor, how would I position the patient, what are the common mistakes that can happen, what are the things that are, so you are always kept on your toes. So when I know in the morning that I have a case of a brain tumor, let's say a basic frontal brain tumor, then I already have to open my book, immediately read it up, everything about the tumor, all the diagnostic that is required, how the operation steps that are required, because when I go there in the afternoon for the presentation, I need to be ready for that. So that is how the training system works here, which is really good because it's very practical system of training. But alongside, the hospital also pays you to go to attend CMEs, to attend hands-on courses. So like yearly, I've been on courses all over Europe, which have been paid from my hospital. So I was last year, I guess, in Greece for a spine surgery course, and before that, I was in Berlin for a brain surgery course, and so on. So these are also courses that are already funded in your career. Then the work-life balance part. Yeah, this is something which is kind of optional thing here. So you have a very good option to decide what you want. If you are someone who loves being at work, who is a workaholic, who is continuously at work, engaged in work, 24/7 in work, That is also an option for you in every field. And if you're someone who wants, no, I just want to work maybe like 3 days or 4 days, and now, I don't want a lot of hassle, I'm okay, I'm happy having my free time. So that is also an option. And not just working as a consultant, even as a resident, you can work part time. So let's say because of some reason, or you have a family, you want to give time to your kid. So there are a lot of doctors who want to give time to their family, and they've decided, now I want to work only 2.5 days or 50% work. And even with that, obviously that doubles the time of your residency, but then you are able to finish your residency in that 50% work time. And one more advantage is the specialty flexibility. So this means that if you want, let's say now for neurosurgery, for example, I'll give my example. Initially, when I cleared my approbation, I was very happy. I was like, okay, any surgical field that I get into, I would be happy to take it. And I applied in all different fields. I had already done hospitation in neurosurgery and in general surgery for 1 month each. So I knew about the system and I had an idea how everything works, which really helped my CV. And in the beginning, I got two offers. One offer was in general surgery and abdominal surgery, and the second offer was in neurosurgery. And then I decided, okay, I'm going to go for neurosurgery. But mind you, these two offers that I got was after sending 50 applications. So it's not that it's very direct or it's very easy. You have to be persistent. You have to show up. You have to prepare very well for the interview, because that is, you have like 10 minutes in that interview to impress the boss. So in that 10 minutes, the most important thing he's going to obviously going to see is your language. Are you communicating properly? If you're nervous, you're not communicating properly, which is normal because obviously you're communicating in a different language. It's not that easy. But if you are not able to communicate properly, then they will have a negative opinion about you, because then if you cannot communicate, they'll be like, how will this person will be able to carry out anything I tell him? So that is very one important thing. And now coming back to the topic, the flexibility part. So you can, let's say now if I started neurosurgery and after 1 year or 6 months, I'm like, no, I don't like this field. Maybe I might just go for something else. So in that case, I could have easily shifted to another field and started in any other surgical or medical branch for that matter, because I know a lot of colleagues who started in internal medicine and then later on switched to dermatology, or who started initially in general surgery and then later on shifted to plastic surgery, neurosurgery, and so on. And the good part is at least 1 year of your experience from this work that you do is counted. So let's say when the 6 years, if even if 1 year if you work in other field, so that is also still counted in your post graduation. So this flexibility makes it really easy. And if you're really that motivated, you have the option that you can do multiple post graduations. For example, I know professor in Frankfurt, in the area of Frankfurt. He is from Chennai and he's a neurosurgeon and a plastic surgeon. I mean, that's really absurd to think from my point of view. I mean, that is like he has double post graduation and he can work officially in Germany in both fields. And he's super specialized. Where now, as a plastic and neurosurgeon, he deals with a lot of wounds and all of that need plastic surgery, and he's really a good example there. So, who is this for? So, basically, the process I would also recommend, when I was already in my third year in my medical school, I started looking at options. What are my options? Where could I go? And I looked at the costs. I looked at what are the possibilities. And honestly saying, for me personally, the cost of going to US, UK, Australia were too high. The exams were very competitive, and I am someone who is not. I would say I am not like a topper or anything who is really good at MCQs, or who would top NEET or something like that. So my focus was basically go somewhere where you have a one-on-one viva type of scenario, because I know personally I'm really good at vivas, and the approbation exam here is also like a viva. So from medical, this thing only, you have to start your research, think about all the options that you have, and then if there is a possibility for you, obviously medical school itself is very hectic, but if there's a possibility and time permits, you can also start learning German. The best time, however, is to learn it during your internship, because there you have your knowledge still in your head, and you will have a little bit of time on your hand where you can immediately start learning German. And till the time you finish, so the basic requirement is that you need to have a medical license. So without an internship, there is no possibility to apply in Germany. So that is the time where you start working as an intern, when you start learning German. And then if you're already in Germany, so then obviously you have the visa sorted, and the system is different, because there are a few people who contacted us who are already here in Germany and want to start their process here in Germany. So when that visa part is sorted, then there's nothing like it. When you're already here in Germany, the process is much easier, and there's a really good chance that we can get you funding for a lot of classes, the FSP and KP classes that you require. This is also applicable to students, international students, but that's a little more complicated. But almost all of our students haven't gotten one or the other funding from the different institutes. And then obviously one important topic also that we want to add is postgraduate. So we have gotten a lot of requests also from postgraduate doctors who are already specialists and who want to continue or who want to shift to Germany. So for them also, the most important thing is that your medical license is first needs recognition. So for example, if you're from India, Pakistan, or Middle East, anywhere also, so your main thing is they are going to first check for equivalence of your medical license. If your medical license is not recognized, your post graduation cert experience doesn't come into question. First you then need to clear your pose for your medical license exam. So this medical license exam is a must for everyone, except if you have already done your education, or your if you have a medical license in EU countries or in UK. Only then there's a possibility of getting direct recognition for the approbation. And then once you have gotten the approbation for the postgraduate doctors, then there's a possibility. There are two options then. Now, this applies to anyone who's also not even a postgraduate. If you have work experience in your home country, let's say you have 3 years of work experience in your home country. So, one thing with a very high possibility is that we can get those 3 years of work experience recognized to increase your salary level to a third year resident salary level. And the second thing is getting your residency recognized to decrease the time for your post graduation. So, like I said, MBBS is 5 years. Sorry, medical post graduation is 5 years, and surgical post graduation is 6 years. So, let's say you've worked 3 years, so you can apply with all the documents to the medical council for recognition of your post graduation. And what happens is they will compare the steps or the guidelines from India and or from your home country to Germany, and then they will decide, okay, how much is applicable. So in case of Dr. Rutuja, she worked 1 year as a resident in as a JR in a dermatology hospital in India, and they compared the qualifications and the things that she had learned in that 1 year, and they said, you know what, this is equivalent to 6 months in Germany, so we would give you the 6 months recognition. um, and some of the and one more thing also that you need to know about the surgical fields is that not all fields need first general surgery and then specialization. Now, like if you say general surgery or urology or ophthalmology, ENT, these are also just for 5 years. And if you go to see super specialization fields now, like neurosurgery, cardiosurgery, and so on, then they are 1 year extra, but you can do all 6 years in neurosurgery. So, and again, so like I said, so for postgraduates, there's a very good chance that we can get your work recognition, and we can get your post graduation reduced. And in case you have a lot of experience, there's a chance that they might completely accept all the years, and then you might just have to give a exam to prove your knowledge, and you might directly be granted the Fahad's title. And exactly, and so like I said, this the salary level also goes up with the experience that you have. Doesn't necessarily have to be a postgraduate, and that can matter. Like a salary level increases from your first level to your Fahad's level in these 5 to 6 years, from almost up to 2,000 euros. There's an increase in your salary. So let's say if you have that level of experience, we can directly bump you up from 5,000 euros to 7,000 euros salary level. So that is also, in my option, a win-win scenario, even if you have to repeat a few years or complete your post-graduation again, because the basic salary of doctors here is also much more um, than the base salary level what people earn here. Then now coming to the most important part for what all the students are here, the roadmap. So first and foremost thing you have to learn is the German language. I cannot stress this enough. This is the most important part. Without this, there is no future in Germany. And you might have heard elsewhere, or maybe for non-doctors, that yeah, you can come to Germany, you can get it done in other fields. No, I'm sorry to say this. If you are in a hope that without the German language you will be able to do or succeed a lot in Germany, I'm sorry, that is not going to happen. You need to be fluent in German, or at least for non-medical field, you need to know German, basic German at least. And there are a lot of advantages from learning the German language, because with the German language, if you have learned it, once you start working as a doctor, you can directly apply for a blue card, which is your for a blue card, which is a special permit that you get to stay and work. And this blue card extension and all of those visa hassles is much less compared to someone who doesn't know German or who's in another field. So for the medical specialty, it's really easy once you are here to get your visa extension and so on. And then secondly, with the German language also, you are applicable to apply if you have already completed B2, which is a requirement. You are also able to apply for your permanent residence within 3 to 5 years. You will be able to apply for a PR. And as of right now, in 5 years, if you have completed after you have started working in Germany, you will be able to apply for for a citizenship as well. So from my personal this thing, I came in 2019 with the C1 level, because like I said, my visa process delayed my process, the whole thing. So I came in 2019 January over here. In March, I finished my FSP. I did my KP in September. In Jan 2020, I started with my neurosurgery residency. I shifted my neurosurgery residency in 3 different hospitals. After every year, every 1.5 or 2 years, I worked in a hospital. And when I came to a point where I felt, okay, I'm not learning new things here, there's a better scope here, I shifted to a bigger and a much more bigger hospital. With the experience that I had in hand, I was able to obviously shift to bigger clinics, which I felt was very optimal for me, because even as a beginner here, with the language, with the whole process, it's very overwhelming. And it is okay, it is going to be overwhelming, and it takes 2 3 months and you'll get through it. So that is the important process here. Yeah. And with that, I got within my second year a PR, and then in my fifth year I got my citizenship. So the German language has, it's not just only for your approbation, it is for making your life, settling your life here in Germany. And then later on, you can decide what you want to do. If you have a citizenship, you are free to work all over the world. Your degree is recognized everywhere. So there are a lot of benefits. So people ask me, is it really worth learning the German language? And my simple answer to you is yes, it's definitely worth it. Then the next step comes is your Defizitbescheid. So basically, this is checking if your degree is recognized. So this is where what happens is, if you have worked if you have gotten your degree in your home country, and or in a country wherever you are, if you have gotten a degree and your medical license in that country, then it's very simple, straightforward. But the complications come if you have gotten your degree in one country and your license in another country. So for German, or for the German Medical Council, this is a very weird concept. They cannot understand it, because like I said, they want you to learn German and only then they let you do medicine. So the other countries that allow it, they cannot really come to terms with it. And that is why a few countries have had issues, especially from, I think, China, Kyrgyzstan, and so on, where there were issues for getting the recognition, where they were like, no, you need to get a license from your study country as well. So we'll discuss this more in the Q&A session as well. Then what happens is, for this Defizitbescheid, you need to focus on getting your documents, and these documents you can start preparing early. So that is also important, because what happens is, as soon as you get your B2 certificate, you can send them. So you don't need to wait till you have finished your B2 and then start collecting all the documents, because then you are wasting those time, because you're wasting time. And with German bureaucracy, it takes time. If you have international experience, you know things don't work really fast. They take time here in Germany. So for this Defizitbescheid, it's best to start early. It's best to start in your A to B1 level itself, that you register, get your documents ready, and as soon as you have your B2 certificate, you send them away so that you can apply for your visa. And this Defizitbescheid is basically the medical council in Germany telling you that, okay, we have evaluated your documents, and you do not it is not a complete match to our system, and that is why you need to give an exam to prove it, that you have the complete knowledge that we think that you need to have. Then the visa application process, once you have gotten the Defizitbescheid, you start with the visa application process. This is also something that goes on parallelly for both the things. So A2 level, B1 level is when you should really start preparing already for the next level. And once you have gotten that and completed the visa part, then you arrive here in Germany. Now that is the most overwhelming part. You will think, okay, everything is done, I am finally here in Germany. But trust me, the struggle is just starting. Your first year in Germany, and this I tell to every student, everybody who is a foreigner here, I tell them, I'll be very honest with you. It happened to me, it happened to Rutuja. I think maybe Nigel was much better, except settled here. But for me personally, it happened. First 6 months, you're going to struggle a lot, and that is the reality of the scenario, because it's a completely different world. So that is why it is obviously good if you have friends, family, or a known person who's there to guide you through all of this, because you have to figure out your house, you have to figure out which bank to register, you have to figure out the Anmeldung here, you have to figure out your everything here. And then once you have figured out that all of that struggle and started your FSP classes, you give your FSP exam. So with the FSP exam, it's a very basic exam. They basically test you about your language, your medical language skill. So they do not, obviously, if you do a big mistake, like if you're saying patient has stomach pain and you're saying, yeah, patient has a brain tumor or something like that, so then obviously that wouldn't match. But they will ignore like lenient things and small mistakes, but what their focus is only on the language. So that is generally in 3 steps. First, is history taking. You have to take history of the patient. Then the second step is you have to write down the whole complete history, and then the third step is a small viva, where they will ask you to present the case, and they'll ask you a few basic questions. What are the lab values? What is this called in German? What is that called in German? And so on. So, for example, even if you say appendicitis, so it's appendicitis in German. So it's not like you're going to say something extremely different. The pronunciation is just a little bit different. So a lot of medical terminology is really easy to understand and grasp. And now, after your FSP exam, you have two options depending on how your priority is. So you can either start working on a temporary license. Once you have cleared your FSP, you get 2 years of uh, the Berufserlaubnis, which is your temporary license to work. So now, generally, what now it has happened is that the KP exam takes time to get the date for the KP exam. So for the KP exam, you have KP preparation courses, and or you have the option of starting to work. And here also you have the option, you could start working part time, maybe let's say 2 days or 3 days, and rest 3-4 days you could attend classes or do self study and so on. So depending on your situation, how you want it, we help you and guide you through it. Because once you are here, you want to be financially independent, you want to be able to take care of yourself or maybe take care of your family back home. So that all of that is possible as soon as you have cleared your FSP exam. So this is the step which really motivates you. Once you have cleared your FSP exam, there's a big sigh of relief. Okay, the first step is done. Now at least financially I'll be able to sustain myself. Financially I might be able to help back at home. I might be able to enjoy my life financially, and I'm financially independent. Yeah. And the good part about this FSP exam is it's unlimited attempts. There are no restrictions to this. And once you have made the decision, okay, you want to start, immediately go for the KP exam, or do you want to start working? Depending on that, you decide when to give the exam. You submit your documents for the exam, and once you get an appointment, you have to give the exam. Now, the KP exam differs from state to state. So sometimes, but mostly how it goes around is again the same thing. You have to go to a patient, do the examination, take a history. This is just like your final year viva, what you do in your final year exam. You go with the examiner next to a patient, you take his history, you do his examination. The professor will ask you different questions about your examination. What are the positive findings? What else would you look for? What is your differential diagnosis, and so on. And then you have to document all of that. And in the third step is your viva. And for this viva, you have 3 to 4 different steps. So, sorry, you have 4 to 5 subjects that you need to study. So, medicine is one of the most important. Medicine, surgery, a little bit of orthopedics included, a little bit of radiology also, and pharmacology, anatomy, and a little bit of Recht medicine, that is the medico legal German medicine here. So these are the most important topics that are asked in your KP exam, and once you have prepared for them thoroughly, you will give the exam. Now, one important thing that everybody needs to know is that you have 3 attempts all over Germany. It does not matter in which state you give the exam, you have 3 total attempts in Germany. If you are not able to clear this, and this is not just the case for doctors, it is just a general rule in Germany for any university student, for any student, for any exam, that if you're not able to complete an exam or clear an exam in 3 attempts, then they say, okay, you're not eligible for this. Please, you will not be able to reattempt here. So I personally, in a very rare cases, I have seen this happening, and you can get help and get 1 or 2 more possible attempts, but that is it. Once you have 3 attempts are over, it is difficult to do it again. But this is not to discourage you. On the contrary, I feel it's a very fair thing, because you have to prepare properly for this. This is not like it isn't this way that, oh yeah, Germany is easy, I just need to know German and I will clear it. No, the level is as difficult or similar to UK and US. So you have to prepare and you have to give in that much level of effort. And once you have cleared your exam, so then you have get the approbation. So now this approbation process also, the medical council just gives you a letter saying, okay, you have cleared. Now you have to go and get your approbation printed and get it everything done. So that itself, again, another bureaucratic hurdle. You need to prepare some more documents that they require. You have to go and get your approbation and so on. After this step is when your post graduation begins. So once you've gotten your post graduation, sorry, your approbation, so then you apply to the medical council. Sorry, you see in the medical council list which doctors have the permission to train you, and depending on that, on the field of your choice, you apply to for that post graduation seat. Now, like for example, when I was searching for neurosurgery in my state, there were 17 hospitals where I could do neurosurgery. So likewise, there are different number of doctors that are allowed to do it. So you have, obviously, the more specialized the field is, the more difficult it is to get into. So you then need to know properly, because there might be doctors who will be searching for someone for a GP, or for someone who's just coming and working for money and not interested in post graduation. So those jobs will also be available on the market. So you need to know if this is a job where you're just working and getting money, or this is a job which is getting you a post graduation as well. And that is also where we help you, like we help you from A to Z from this process, then how to apply, where to apply, how to find out which all doctors are there, and so on. Then coming now to the first step, like I said, now there are 5 levels here: A1, A2, B1, B2, C1, and there's also C2 level. But C2 level you don't really need. You need your B2 level to register for the exams. And like I said, you can start preparing B1 onwards for your Defizitbescheid. And the earlier you start, the faster are the chances. So for now, this step from getting to A1 to C1, I think it took me about a year to get from here to here, this level. I did it with Goethe Institute, so they have their fixed timings, they have their special course, but this can also be completed in 8 months or so if you're doing it through a private tutor. But most important thing, what you have to understand is, even if you are C1 level, once you come here, you're going to feel that you are A1 level, because what they teach you in class and what the reality is something completely different. And it is okay. There's no issue with that. You'll eventually learn it. It's a language. So you have to be patient with yourself. It is not medicine where you have studied it, you know it, okay, this is how it works. There is logic, there's research, and there's scientific methodology in medicine. In German language, there's no such thing that way. So you just have to be patient with yourself. The more you speak, the more you talk in German, the better you'll get at it. The more you write, the more you read, the better you will get at it. It's just a process that takes time. So you have to be very patient in this, and you just have to trust yourself, and always try to speak in German, to make corrections. Because what happens is, sometimes, if you catch something here, some phrase or some method that you're speaking wrong, that will stick with you. That happens to me often, that I see that some grammatical mistake that I make, I still make it when I'm talking to it. And in a real life work scenario, a small grammatical mistake nobody cares about. They understand you're a foreigner, you're not going to speak extremely fluently, you're not going to know every word. The main thing is you're able to communicate it properly. That is what is important. So then the next steps are the Defizitbescheid and the visa application. So the Defizitbescheid, like I said, it is applied to the Ärztekammer. They check your degree. If it is equivalent to the German degree, Germany has ANABIN H plus list of universities that they recognize. If your university is not in that name, then the university is not recognized. You can apply for this from B2 onwards, and it takes around 1 to 3 months. Now, this was the document that I had struggled getting. So I applied in a state, and they told me clearly, they said, okay, you're from this place, and we will not be giving you the Defizitbescheid, will not register your documents. So I was stuck here. And then later on, after just finding out a lot and coming to Germany on a visa, on a tourist visa and all of that. I inquired here, and then I went to another state where I got this document. So this thing delayed my process by 9 months. And if I had known all of this information, where I can get it for fast, and in the similar way, I gave this information to Rutuja, and she got her deficit Bescheid after completing all her documents within a month. So where I waited 7 8 months, she got it in a month. So it's not something about luck or anything. It's just that the process you need to know. And here you could really see that 6 months were saved just because we knew the process and got some reliable source. Then the visa application. So you need the 16D type of visa for FSP and KP. This you need to apply through the German embassy, and you need the deficit Bescheid to apply for the visa application. There's also a possibility to come on a job search visa, but then converting it and getting all of that is too much of a hassle, and it's extra expenses. If you are that motivated that you want to come to Germany as soon as possible, you don't want to wait for this, you can come to Germany earlier through this job search visa. You can finish the German language here and then change your visa to the other one, but it's again a complicated process. So that is, but also one possibility that is now opening up. Like now we have a student who came here on the job search visa, and we are figuring out the possibility of getting her as soon as possible into the classes. And as soon as she gets into the classes, she might be able to change her visa, and so on. So that is also one possibility. Now, getting your cover letter is also important. What the embassy needs from you, irrespective of which visa you're applying, the embassy needs a plan. They need to know what are you going to do, how is your plan, and do you have the money to do it. These are the most important steps, and we guide you exactly how you should present your plan, and how much money you need to show, how do you need to show, and how you need to prepare for all of this. Now this takes some around 2 to 4 months depending on your embassy. So we have a student now from Delhi. As soon as he cleared his B2, he got his deficit Bescheid in a month and his visa in a month. In 2 months from Delhi, he got all of his application, everything ready, and he's ready to fly out now. I think he'll be flying next month to Germany now. So it depends on your embassy also how fast they work. From experience, I came from Mumbai embassy. They are a little slow and sluggish, but Delhi embassy right now, and even in South in Chennai embassy, I know Chennai and Bangalore embassy also are quite fast from what I know. Another student that came from Chennai embassy, she also got it really fast. The exams, now we have discussed this already plenty in detail. And the most important thing that they test is your communication skill, medical communication skills, which is in 3 parts: your doctor-patient consultation, handover, letter writing. It is conducted by the medical council. You require B2, and once you pass, you can also apply for a temporary license. And here at MedZiel, we guide you obviously how is the whole process, how to prepare for it, and so on. The Cantonese proofing. Now, this is the main exam, then this is the most difficult exam. So you could consider this at step 1, step 2. This way, now this is where you have a big viva in all of the subjects that I mentioned: medicine, surgery, pharmacology. These are the 3 main subjects, and then a little bit of legal medicine, a little bit of radiology, orthopedy, and so on. This is an oral exam, and this is required obviously if the deficit Bescheid shows knowledge gaps. Like I said, in some cases, if they accept your degree, if you're from the EU or if you're from UK recognition license, so there's a possibility to completely skip this exam. This can be prepared. FSP exam is also required for the as a criteria for the Cantonese proofing, and once you pass, you get complete, this is the part to full approbation. So then you get your approbation certificate, and we cleared this, like I said, in 2019 I cleared it, and in 2020 Nigel and Rutuja also cleared it. And all of us, within arriving to Germany, within a year, we were able to clear our exams. So this is the most important thing, because the longer you wait, the longer it gets, the less, the more you have to financially strain yourself. So it is really important that you finish this off really fast as possible. I know for a fact I have a few colleagues who are still, they have came here in 2019 and they have still not cleared the kindness proofing exam. They are still working, didn't clear the first time, and so on. So that is still possible. As you can see, from 2019 they are still here in 2026. But the longer you wait, it's not going to make it any easier. You have to give it your full effort, your full shot, and the best time to do is immediately as you come. So the common mistakes is, like I said, thinking too much. Is Germany or learning German good for me, or so on and on. If you have made your decision, okay, I want to come to Germany, then there is no question. You need to start learning German. Every month counts. Start as soon as possible in your internship, if at all. Then applying to the wrong state. Like I said, from my personal experience, I was rejected, I was blocked for almost 9 months because I just applied to a different state. And when I applied, when I got to know more information, and then I applied to another state and I got it immediately. So it is also important to know which state, what documents, and how, and everything is required. Now, incomplete documents also, if you are not getting your all the documents ready, if there are translations missing. Now remember this, one document delay means a month of delay. If you fail to submit one document, you will have to, they will, for them to reply to you will take 15 days. Then you prepare the document, let's say in a week, and then you send it to them, and then they receive it, they check it, at least a month is gone if you miss just one single document. So that is really important, that you have all the documents in your first attempt. When you are sending everything, send everything together, send it everything in a proper format, so there are no issues and no delays at all. Again, the cover letter for the visa, like I said, people prepare everything and they're like, yeah, I'm going to go there, I'm going to be a doctor there. No, it does not work that way. You need to give them a complete plan. You need to give them a plan, how you're going to work, where are you going to study, where are you going to stay, how are you going to financially support yourself, and so on, and how to do all of this. Each and every step we guide you in all of that. And exam strategy, now this is one very important thing that I personally, when I was also learning, realized. So what happens is, you come here, you are attending classes. The classes are going to teach you a little bit of everything, all the topics that I said. And once they have taught you everything, they'll be like, yeah, good, you're ready to go, give the exam. But what the examiner needs, so I don't know how it is right now, but when I was in my medical school, I remember our seniors used to give us markings, we used to call it. And they used to just give us all the important topics that are generally asked in the exams, and you need to study that. So it is the same thing here. And they tell us, like, I found out a lot of people who gave exams, and then I communicated with them what all did they ask them, what does the examiner want to know. And so you can very smartly prepare everything if you know who your examiners are going to be, or at least prepare for the common examiners that are come, and from their specialty. So if you know, if there's an orthopedic surgeon coming who's going to be your examiner, so obviously you're going to have to study a little bit of orthopedics. If you know that there's a pharmacologist coming here, so then you need to know pharmacology really well for your exam. So these things matter, and how to prepare, what to expect, what examiners are there. We are constantly updated in this because we have a huge network here of doctors who are continuously giving exams and then feeding us also with this information, that okay, yeah, now this was my exam, this was my questions, these were the professors, this one. And then you do a little bit research about that professor as well. Has he published papers, has he done any research or something? There's a possibility he might ask you for that, and this applies not just for your approbation and for your further studies as well. And then the last common mistake to avoid is your no guidance or wrong advice. So like I said initially, we were I and Nigel, I remember that is how we got through wrong advice. That is how we connected with each other. So we both were guided on the wrong path through agency, where both of us were stuck. And then once eventually we figured out this thing, which ate up a year or more for Nigel, I think. So which ate up a year of our time and delayed everything for coming year, that I would really recommend to avoid. If you are sure you know the process, you can do the process, you can do it really well, perfect, go for it. If not, if you have doubts, if you need help, we are always there. So how do we help you? Like I said, it's a personalized roadmap. There is no one way for everyone. We do not tell you, okay, yeah, there's a basic steps are the same steps, but it's not like you need to go only to this institute because we work with this institute, or you need to go only to this state because we know this state. It depends on your priorities and your. So what happens is, once you come to us, we will discuss with you. We will. So what I generally do is I ask students, do you have any family and friends here? That is the most important factor that you need to understand. If you have family and friends here, my recommendation is go to the state where they are, because that makes things easier. You have someone who is there to help you, who is there to guide you. We are also there to help you and guide you. You can come to our state as well. But other than that, also, if you have some known person there in Germany, that is the best state to go to. Unless, obviously, it is a state where the scope is less, or the difficulty is different, or some of that. So we are aware of all of these situations, and we discuss with you all of the possibilities that you have, which classes then you can attend through in these states, how to get funding for your classes, yeah, and so on. And then the deficit beside this roadmap, we plan it with you. Then we start with the process immediately. So as soon as you're in your A2 or B1 level, we start with your deficit beside guidance and your application, getting all your documents ready. And then immediately we start with the visa support as well, getting everything ready, preparing you for visa interviews, mock interviews. Then settling in Germany, this is also what we offer, that if you don't know anyone now, a lot of students are obviously coming first time and alone and taking this big step alone. So we don't want you to feel alone. We want you to know that, okay, we are there with you, we are there to support you if something goes wrong. So we are there also to help you, not just in medical related stuff, but also for your accommodation, citizen registration, bank accounts, and all the miscellaneous things, the German bureaucratics that you need to take care of. Then the most important bits, like I said, this insider tips, how to study, what to study, how do you plan it, what all are the important topics that you need to know, what examiners are actually asking questions, what is the German standard, which books to use, all of that we help you and guide you. And then after, once you have cleared all of the exams, how to get into your dream residency, and in between all of these steps, how to get into a hospitation to get more experience, and so on. So, like I said, our MedZiel team comprises of 4 founders, me here, and then Dr. Nigel, he's a Facharzt in urology, Dr. Rutuja, she's a Facharzt in dermatology, and Mr. Jay Doshi, he's our operational head in India, and our first point of contact for all the students there. So we'll just take 2 minutes of short break, and I would also then invite Dr. Rutuja Kulkarni to join us for the Q&A, and both of us together will then start discussing all your questions here in the chat. So please, whatever questions that you have, write it down in the chat, and one by one we'll answer all your questions, any doubts that you have. Like I said, no question is too basic. Ask any question that you have, any doubt that you have. Now this is your chance, clear out everything. And exactly. So we'll just take a short pause for 2 minutes. I'll just invite Dr. Rutuja Kulkarni to join us, and then we'll resume with your questions and answers. So like I said, use this time, frame your questions, write down all your question, and best option is obviously write one big question so that I can see and I can discuss it properly with each and every one of you, so that all the questions are answered and none of the questions are do not remain unanswered. Okay, so we'll be starting now with our question and answer session. Just a second, I'll just share the screen. So we'll start with the questions. First, I'll just add Dr. Rutuja Kulkarni here. Okay, so she's also here with us. Hi, Rutuja. Your mic is turned off.
Hi guys, it's so glad that you all are here and we can surely start with the question and Q&A session now.
So the first one is from Rohabriya's sources, resources to cover FSP material and medical terminology. So there are a lot of sources that you can use. There are 2 3 textbooks that you get here for studying FSP, and there are for medical terminology. But honestly saying, what I would say is nowadays with chat GPT and Cloud and everything. It's really easy. You just tell him to teach you that, and you can start learning it at any level you are at. You don't need to buy a textbook like you did 5 years ago. Now you have a lot of things available online where you can just directly go it and check. What I did personally was I just opened a YouTube video, and I just initially started learning what is every body organ called from top to down. Then I started opening anatomy videos, and then one by one I leveled up to physiology and then medicine and so on and so on. And a lot of terminology is same, so it's not that difficult. And then you could also try using apps and all that help you also with the medical terminology. So that is also one of the resource that you can use, but this is something you should start as soon as you're in B1 B2 level, or just to see how difficult is the German language and all. You just put it up on ChatGPT, tell him teach me a few words, medical words in German, and so on, and they do a really good job in all of this. Now Dr. Ruhabrias has also four questions in total, so I'll complete all of those. Which state to prefer as foreign graduate? So again, like I said, what I tell you is the best state to go is the state where you have friends and family. If not, then I would say Western or Southern Germany is better in comparison to East Germany. I would personally not recommend East Germany because it's not that they are difficult or you won't get a job or this thing. That is all possible, but it's just how the small differences that are. A lot of foreigners live on east and south of Germany, so it is easier to settle in these areas in comparison to East Germany, where it is a little bit difficult. It's nothing is wrong in it. People do settle there. There are a lot of foreigners living there as well, and they are happy with their life and everything. But I personally feel that West Germany and South Germany are much better options. Then the third question: how to make sure documents are proper to getting the deficit Bescheid and getting smooth. So this is like I said, you need on the medical council when you need to apply. There's a huge list of documents that you have to go through one by one. You need to check if everything is there. There's a proper format that the medical council accepts, and all of these we guide you everything that is needed from top to bottom, A to Z, uh, whatever is needed. Then the fourth and final questions. Any way to connect with a native German doctor to practice speaking with? So yeah, there are online apps where you can do that, but if that person is a doctor or not, it's difficult, and it depends if you know someone or you want to speak to them, you can do that to practice speaking with them. But honestly saying, instead of speaking to a doctor, I would recommend going to a proper German teacher, because they are the ones who properly teach you how the language should be, what is the grammatic and everything. Once you know that, talking to a German doctor is no issue for you. So you need a good German teacher, not a native German doctor to practice speaking with. The speaking part during your FSP you can do with other foreign doctors who are also at your same level, that we already recommend, and we also personally recommend students to start talking to us eventually in German, so that they get a hang of it and to discuss all of it. Okay, then the next question. So Rutuja will answer this question for you.
So, which specialties are easier to get into? Honestly, if one wants to go for internal medicine, general surgery, that is possible. Like, I wouldn't say it's easier, but it's comparatively better to get into those fields. But fields like neurosurgery, dermatology, ophthalmology, ENT, those are a bit competitive, radiology as well. But easier would be general surgery, then general internal medicine, and it depends on your CV, what experience you have that makes it easier. Anesthesiology is also easy, so one can if try for that as well. But yeah, those are the fields which are pretty much easier to get into. Yeah. So we can move ahead to the next question. Is
Wait, also I would like to add to this. So like we got a few this thing psychiatry and so on. So in easy terms, what I would tell you is any field that is difficult, and any field that requires a lot of work. So Germans do not want to work a lot. They really have focus on their quality of life and work life balance. So neurosurgery or surgical fields, for that example, unless you go for surgical fields that have good work life balance, like ophthalmology, ENT. So those fields, yeah, they are difficult to get into, but fields where you really have a lot of work, and in comparison, let's say to now to dermatology or to radiology, where they have a lot of work, but the pay and flexibility is much better in comparison to a surgical field. So there it is much easier to get into. So that thing is also, now psychiatry is also a field where there is a lot of options here. Neurology, for example, I know neurology, our hospital has a neurology department that's 24/7 has a opening. I think neurology you'll find in every corner there's a neurology position available. Obviously it's not that easy, but it is available, and once they find a right candidate, they take that candidate. Now going on to the next question, again from Iti Gupta. How much money and time it costs for documents verification and exam clearance? So we've made a video on our YouTube channel. You can check it out, about how much money it cost with the time. There's a complete YouTube channel in complete detail about this. And once we'll do also webinar explaining the this thing. So uh, time I would say is 2 years if you have just started, is a good time to consider. If you have just started A1, completing everything would, I would say, 2 years. And money would depend on how much, which courses you are attending, how much does the German language cost. If you're doing through a private tutor, obviously it costs more. If you're doing through Goethe Institute or something, the prices are comparatively lesser, and so on. Even here, if you get funding, so that decreases your costs, and we help you getting this funding, which is around 4 to 5,000 euros, which you can get funded, and so on. So check out that video, and there it is completely discussed in detail. Then for the next question, the Rutuja will take over.
So the resources, like Faiz mentioned in the first question itself, they are like from different areas. I think we can skip this question because we have already discussed it, and we can go to the next question. Is there any racial discrimination in fields? Honestly, there isn't any kind of racial discrimination, not what we have experienced so far here. But obviously, what they see is that your language level should be good. There is no racial discrimination if that's what you need to know. But they will obviously judge you or select you on the basis of how good your language is. So please do not do not take it as a mistake, as a uh, part that you're discriminated because you're not from Germany or something. It's purely based on how good German you speak. Yeah, we can go to the next one. Real job scenario in Germany for doctors. So there is a shortage of doctors in Germany in multiple hospitals, clinics, and like I mentioned earlier, there are fields which are more competitive, and there are fields where there are jobs always available in the hospitals, especially the hospitals which are not in the big cities and in the smaller towns. There are always job openings for doctors, and I don't think that is going to be a problem because job openings are always there for doctors in Germany. And yeah, we can go ahead. After starting working there, how much time does it take to get citizenship there? So this is a completely different topic altogether, not related to the German PG, but um, present rule says it depends according to your level. If you're 5 years living in the country and have more than B2 level of language certificate, then one can apply for the citizenship. And Dr. Faiz Sheikh has already got his, Dr. Nigel has also got his. Mine is still in the process, but after 5 years, one can definitely apply as doctors, because as doctors, we come under skilled workers, and we already have a high level of language level, and it makes it much better. The chances are much better to get the citizenship. Yeah. Le- What about FMGs? Maybe Faiz can take this one, this question.
So, regarding FMGs, Dr. Nigel is our expert there. He himself is a FMG. He studied in Russia, his MBBS, and then alongside three of us almost came together in the short span duration to Germany here. And so the process is, it depends on your home, on your study, your country of study. So if your country of study is, like I said, Russia, Ukraine, Georgia, Philippines, so on, and you have gotten your license and registration in your home country, then the scenario is different. Then you need to, the main criteria is your degree, internship completion, and a medical license. These three things are compulsory. There is no question, there is no alternative other than these three things. Yeah, I've heard about cases where they have finished their degree in Europe and then they did their internship here in Germany. But that is also, honestly saying, a complicated path. You need to get again into the medical school here, which is again difficult, and it's a very complicated route. And also, in many cases, they reject that. So it happens very few, in very rare cases. And the best thing to do is obviously finish your FMG, your get your degree, finish your internship, get a license, and then once you have the license, you are treated as equal. Except, sadly, for some institutes or some colleges from China or Kyrgyzstan. Now, I personally have not dealt with a student who hasn't gotten their recognition, or a student who's come from these countries, but I have heard about issues happening with these students. So honestly saying, if you are someone from there and you have not yet started your German, then I personally would tell them, okay, really think about it, because there is a risk that they might reject your application, or ask you to go back to your home country and get the license. In that case, you might have wasted a few times. So in such cases, I call them as high risk scenario, and we obviously would help these students out. But you really need to make sure that you're, if other people, let's say, are going to have a hill, you are going to have a huge mountain in front of you to get to the post graduation. But on that note, I know a doctor from China. She completed her MBBS in China and then got her FMG in India, and then she is right now working as a surgeon here. So, but this was the scenario around 5 years or 4 years ago. So the things have gotten changed. So in that case, it really, in FMG case, it depends on where you have studied and what you have studied. Then Soumya had another documents. What are the documents you need? So, like I said, for FMGs, most important are these three documents before you start learning German, or if you're side by side you're learning German, is your degree, your license, your internship completion certificate, and then depending on the medical council, you would also need your internship completion certificate. You would need a CV, and but these are not just specific to FMGs. These are applicable to all the doctors, and all of this can be found on the website of the medical council. They have a complete detailed list of everything that they need for their exams. Then coming to the next question, what is the overall cost? So like I said, roughly, if you're going to see, the cost that come up to you are, firstly you need for your classes. So German classes you need, depending on if you go through a private tutor or to a German institute, there you will first have your first cost. Then your second stage would have cost for your FSP and KP exam classes, and then you'll have FSP and KP exam itself fees, and you will also need to show 1 year of blocked account in Germany, which is like a account which shows that 1 year when you will be preparing and you don't have a source of income, then you how you will support yourself. That is a guarantee to the German government or to Germany, that you have 1 year worth of money to take care of yourself for your rent and for your stay and all of that. So this is basically your money itself. It's not a extra cost. So all in all, you could say maybe around, depending, like I said, maybe 20 to 30 lakhs rupees in total, everything if you combine it. But like I said, we made a complete detailed video with the timeline and the cost and everything, and how we can help you reduce those costs by up to 5 to 10 lakhs depending on your scenario. So that I have discussed everything in the video. You can check it out on our channel. So then I'll go to the next one. So now this is the most hot topic right now for, sadly, a lot of graduates from China and graduated from China and working in India. Like I said, you would need the best case scenarios. Obviously, if you have a Chinese medical license, then there is no difficulty, there is no issue. You can definitely come to Germany. But if you do not have that, then it's a little difficult, and the process is, like we already discussed, a little difficult. So, and then next question here. This is just an introduction from Dr. Divya. She's an anesthesiologist working in Germany. So, like I just discussed, as an anesthesiologist, you have a very good option. Firstly, it's a field where you have a lot of work, where it's a lot of time that you need, and depending on how you want to go into it, the scope is really good in anesthesia here. There are a lot of jobs available, and if you already have anesthesia PG, then it is very easy to get into anesthesia, because they obviously respect your work experience. It is not like if they are taking an exam that they do not respect you. They respect your work experience and they do consider it. You need to, if you have work experience, they really take that as a positive thing, even if it is in your home country. There is definitely no negative to that. And in your case also, here we could get you recognition, like I said, or a higher payment, higher salary in this case. So again, it's a person to person basis what we can offer here. Then coming to the next question. So again, a FMG question. So I'll continue with this. MBBS in Armenia, but I don't have a license there. I did give FMG and acquire Indian license. So in Armenia right now, at least as of up to date, I have not heard about problems from Armenia. So it is possible to apply, and you can contact us and we can guide you through the whole step. But like I said, firstly, look into all your options, and if you've made the decision, start learning German, and then side by side we can connect, and then we can explain to you how the process is and so on. Okay, one more technical question. Yes, our recording will be available. You can all see it the whole time on our YouTube page, and you'll also get an email with a complete recording and all that we have discussed here. So now there are a few. Now I'll just hand over to Rituja for the next question.
So, ophthalmology is one of the most high earning fields in Germany. So, it's one of the greatest options, I would say. But since it's one of the fields which has more flexible working hours, less emergencies, it's obviously a bit competitive to get into ophthalmology. But Germany is definitely good for ophthalmology because it's one of the highest earners here in the compared to the other fields. So yeah, one can surely try, and if they have extra experience back in their home country, then definitely one can apply for it and get more experience here in Germany as well by applying for hospitations. And yeah, ophthalmology, like I said, is one of the good fields to apply for in Germany. So, what are the emerging fields in Germany? Um, Emerging as I'm not technically sure what do you mean by emerging fields. The medical fields have always remained the same fields. Like the presently, a lot of surgical fields are the ones which a lot of people are opting for. Like let it be cardiovascular surgery, neurosurgery, um, then what to say for gynecology as well. But as such, emerging fields, I really did not get that question really well. But maybe I don't know if Faiz has any insights on it.
Yeah, I think what you mean is that, like in India also we have few fields that emerge, like specialization like neuroradiology and so on. So yeah, that is also a possibility here. So now just like an example, in neurosurgery we also have the neurovascular, uh, then neuro-oncology and so on. But this is not specifically a degree type here. In some cases, yeah, it's called a Zusatzweiterbildung. It's like a secondary specialization that you can do. And in some cases, no, it's just then you have to go to a hospital that teaches you that. So if the hospital, let's say, has a really good vascular surgeon or a neuro onco surgeon, so there you have the possibility to train under him, and then you can also get into neuro oncology. So now, like in case in my hospital, so we have three options. We have spine, we have neuro-oncology, and neurovascular. So these three options you have depending on the team. There's a team divided. This team is more specialized in that, and this team is for neuro-oncology. This team is for spine, and so on. These possibilities are there for you. Likewise, in radiology, for example, I know we have a huge team of radiologists in a hospital, and they also have like neuroradiologist, and then general radiologist, and so on and so on. So those are the possibilities I think that is being asked here. Then
Mm,
I have FMG, I have registration in India, and what are the odds of getting orthopedic surgery? Really good odds, I would say, because orthopedic surgery is like one of the most lucrative fields. Every single hospital that you find here has them and needs them. So if you have a little experience, that would be the best thing in orthopedics. But orthopedics is a really, really good field with really good work-life balance option. Obviously, you have both options, but a good work-life balance options, good future perspectives. It's a field that is not going to die anytime soon, and the chances of getting it, like I said, but your FMG, it depends on your country. So if it is China or Kyrgyzstan, then it's a different question. But if it's like Georgia, Russia, or something, then the possibilities are different. So that's a really good scope that you have there. What are the chances of getting nuclear medicine? So nuclear medicine is also possible, but it is in comparison. Now if you say to orthopedics, it's a little different and it's a little difficult because there are comparatively less number of hospitals that offer that. So like I said, again, it depends. Now if you compare these three, for example, so neurosurgery has 17 hospitals, nuclear medicine might have 30 hospitals, orthopedics might have 50 hospitals. So obviously, if you go statistically, you'll have more chance getting into a field that has more options. But like nuclear medicine also, or for that matter, I said you have an option in case you do not get into nuclear medicine. You can start general medicine and gather some experience for 6 months or 1 year, and then shift to nuclear medicine. This part after your approbation that you work will also be counted in your post graduation, and you'll still be able to do nuclear medicine. Then the next question, I'm a Park graduate, 2 years home country now, working as a GP in Dubai with 1 year of experience. I want to do specialization in Germany in internal medicine. That is definitely possible. I think going from this, you must be having then a license from Pakistan and from Dubai. So both licenses are applicable in Germany. The process remains the same. You need to learn the German language, and then you need to get all your documents ready, and then you can come here and finish your exams. And internal medicine, that is like bread and butter of every hospital. So internal medicine jobs, I think here in my city itself right now, if you just open up and search, you'll find at least 5 to 10 job openings for internal medicine. Internal medicine is a really good field because you have a lot of options, a lot of flexibility to move into any damn area that you like, and have a work life balance however you want. If you want to live in the hospital, you can do that. And if you just want to work locum services, or you just want to work 1 day a week, that is also a possibility. So it's a really, really good scope of internal medicine, and there's a huge demand of internal medicine doctors here. And a lot of people actually go into internal medicine, and then once they have settled into the system, then they shift on to different other specialties. So, what would you say about general surgery and then doing a trauma certification? That is also possible. Here, the trauma is dealt by orthopedic surgeons, and so general surgeons also have their trauma certification, but mainly the orthopedic surgeons do with the trauma. But this trauma is also now called as the secondary certification, which is applicable and which can be done after your first surgery, but in day-to-day life also. So now, like a trauma scenario, what I can tell you is when we have a trauma case, so the general surgeon, the orthopedic surgeon, the neurosurgeon, the anesthesia team all get informed. Everybody gathers in the emergency department, and then as soon as the patient is delivered by the emergency doctor, we all discuss it as a group. It's called shock room or a shock room, where the patient comes in, and then there is every specialty looks into the patient. There's a quick discussion into what diagnostics are required, and depending on what all is required, the process carries on. So the trauma is a very good scope here for trauma and for general surgery. Like I said again, it's available in every hospital, so the scope of getting to general surgery is out really good. Then again, FMG, 4 year MD degree, also fourth year is clerkship and hands-on training. I have no postgraduate internship, but I have a medical license. As long as you have a medical license, this is really good. Even if you don't have a postgraduate degree or an internship, this clerkship and all, we can, that is a question for later on. Your first step is always getting the medical license. So that first step, getting a medical license in Germany, the Approbation. So your first step is already done. You have a medical license, you have a degree in your home country, so you are applicable to apply. And then once you get the approbation, then we can see, depending on what exactly you have done in these 4 years of MD degree, for the recognition process. But in this 4 years of your MD degree, there's a very good chance that we can get it recognized to get your salary bump of around maybe 1,000 or 2,000 euros on a monthly basis. Also, the FMG, again, like I've said it so many times, depends on the state or the country that you are from. So I'll just give it to Rutuja.
Okay, so the next question is, sir, is it easy to learn medicine in German language compared to preparing for AMC or PLAB? So everything has its pros and cons. Learning German language is obviously something that you have to put a lot of efforts and time into. But when it comes to medicine, most of the terms are Latin terms. So only the most of the times the pronunciation is different, or what you tell the patient, those words are different. Comparing to AMC and PLAB, obviously for PLAB and AMC, you have to study everything in English. Maybe you have to clear your IELTS. But if you have to compare both the pathways, then obviously in Germany, there are more, what you call it, it's not saturated like how it is with PLAB. It is it is slowly getting to that level, but it is still now not saturated. Still, it's welcoming a lot of doctors from foreign countries, as in compared to PLAB or AMC, that's not the case. And with PLAB and AMC, obviously the advantages that you have to study everything in English, but then you have to decide which fields you want to get into if those are available in that specific area. Secondly is the working hours. They are the work life balance, I would say. In my experience, it must be different for every person, but in my experience, the work life balance is much better here in Germany as compared if you plan to go to UK or the other countries. And getting the field of choice is also much more flexible in Germany. So in if you ask me, putting that efforts in learning the German language is worth it. And just because you don't want to learn a new language and just going in that comfort zone and learning for PLAB and AMC in English is more comfortable, one can go for it. But both has advantages and disadvantages. So yeah, maybe the next question. Hey, for FMGs, does registration from study country is a must? I have home country license. So Faiz has emphasized on this today a lot, many times. I guess it's getting repeated, this question. But when you have a home country license, then it is possible to get it registered in Germany by the medical council, and one can come here to give the exams. And yeah, does the registration, yeah, okay. Does getting internship and JR doc certificate from study country is valid? Does so if you have, like I myself had done a junior resident position in India and I had the certificate and I had submitted it to the medical council here. And yes, they recognized a part of it, if that is what you're trying to ask. And internship is a must. Like I feel in if you have done internship in your home country and you have a home country license, those are the prerequisites to apply in the German Medical Council. JR Doc certificate is optional. That is more for you getting your experience recognized or your post graduation recognized here in Germany. And that obviously is a later stage which comes to after you have got your medical license in Germany and secured your post graduation seat to get it recognized. But that's possible. Is it easy to enter specialty training in Germany for IMGs from third country? Um, Easy is nothing. Obviously, like it's we have mentioned earlier, if you have your license from your home country, then it is possible. But that's what matters at the end of the day. So you need to have a license of from your home country if you want to enter into Germany for your specialty. My college and MBBS course is already recognized by German government as equivalent. Will I have to give KP? Uh, I'm not sure if I'm understanding what you mean by recognized by German government. There is a process where you can try getting it recognized. That is like a parallel process, like a equivalent process to Kenntnisprüfung. That's called Gutachten. But if that is recognized, the medical council that has recognized for you, that makes the decision if you have to give the KP or not. It depends, it varies from every medical council here in Germany. But and it depends from which country you did your MBBS from, if it is equal to the semesters what were here in Germany. According to that, one can definitely say. But if it is recognized by by the German council here, they can give you the decision for it. But most of the time, if they have said yes to the Gutachten, then one can actually skip the step of KP. But this step is in very rare case scenarios possible. It is not always what do you say recognized. But maybe Faiz can elaborate a little more on this. I'll just give it over to him once.
Yeah, so basically depends on from where you are. Like I said, if you're from the EU or from UK, if you have a UK degree, then the recognition process is given. But if you are not from there, if you're from a European country but not the EU, then it depends on which European country. So you'll have to give us more details on this, and then we
Mhm.
can elaborate on it. Also, I would just like to inform everyone we will be going through all of your questions, so please stay online. We are but giving time to each question because we see that you all have a lot of questions, and we want to make sure that we thoroughly answer your questions. So I'm in fourth year medical school, wondering how is it in Germany. So I joined, and I'm considering about it. So like I said, from my experience, when I was in my fourth year in medical school, I was also looking into Germany, and I was very curious about it, and never in my wildest dream thought that I would be sitting where I am at right now. So yes, like I said, there are a lot of advantages here. There are not just from work wise, but from your quality of life wise, your ease of access wise. Like your German degree, once you get your degree here, you're applicable to work all over Europe. In complete EU, you can later on decide, no, I don't want to work in Germany. I want to shift to Italy on Amalfi Coast, or I want to live in Spain on an island. That is also possible for you. Once you have gotten your recognition, you want to move to Switzerland, that is also possible. You want to go back to the UK, that is also possible to you. You just have to give a small language exam, and you are applicable to work in all of those countries. So that it opens a lot of doors. If you go to technically go to see, it opens you all of Europe, all of Middle East. Once you have cleared it with your, and if you take a German citizenship, it opens up all of the world for your free travel, free working, and so on. So the positive benefits are outweigh the negatives, I would say. So registration from home and study country, this we have discussed a lot in details. Like I said, for FMGs, it depends on your FMG country. Free material that we can use in home country, do we need to complete both deficit beside verification and KP to get approbation? Yes, obviously you need all both of that. And the free material to use, I have already told you. Nowadays you can just tell chat GPT or cloud that you're learning, Gemini or whatever system that you use, that you want to prepare for medical German, and it will teach you everything. You don't need any other material as such. Obviously there are, if you join classes, they'll also provide you with material for all of that, and then we provide you with actual topics that are important that you study, and proper medical textbooks and all of that. But at a stage, if you just want to look into it, how to go about it, how does it look like, you can just ask any AI and they'll tell you about it. UK, Australia, India is saturated. Current job situation in Germany. So if you go to a big city, obviously it is difficult to get into. And if you're willing to go to a smaller place, then the possibilities are really open to you. And now, what I'll be honest with you, a big city, Germany is not that big. Point number one. Secondly, it is a big city is within 1 or 2 hours reach from any small place. So I remember I used to work in a very small place initially, and that was like a really small town. But I used to still live in a city and travel there. It took me 45 minutes to get to work, which is like the normal commute time here. So yes, if you are not very specific and not very stubborn that you want to begin the work in the biggest and top hospital, then you have all the possibilities, obviously. Can I use pro recognition government pathway for recognition? Yeah, you can use them. Pro recognition is that government, this thing, they uh, help you as well, but they obviously, again, like I said, they are this thing from India, and they help you only with the process to get your uh, to come to Germany. What the ground reality is, how does it work, how do you prepare for exams? They obviously do not know all of those things. But yeah, in India, if you want, you can obviously contact them. How hard is it for a Nepali graduate to get residency in Germany? As hard as it is for any other graduate. So your language needs to be really good. That is what matters. Rest, everything can be done. On that note, I'll tell you, I recently got a colleague in neurosurgery. He started working with us. He's also from Nepal. And the most important thing that I see by him is that his language is really good, and that is how he got the position. Is it easy to learn German and study PG in German language compared to, since we all know English more fluently at this point? Like we've discussed this question already. Um, it is in comparison, obviously, but it is a language, so it takes time. You need to be patient with it, and because you have a lot of opportunities here, they people are still very patient with you as a foreigner. Obviously, they do not expect you that from day one you'll be really good at it. So I would say, in overall, if you go to see comparing saturation, frustration, what people go through in English-speaking countries, Germany is a much better option, in my personal opinion. And like I said, later on, if you are not happy here, your degree is recognized in UK, you can get a UK recognition. From UK recognition, you get direct recognition into Australia, into Singapore, into Middle East. You have almost whole world open to you. So you can later on also decide, okay, no, I don't want to be in Germany, I want to go somewhere else in the world. You have the German passport, you have the German degree, and the whole world is open now to you. So it's just a win-win there. This question I think we've already discussed. My country of graduation is Philippines. Yeah, that is very possible. So if you have graduated from Philippines, I think this information was not there last time. So if you have done it in Philippines, yes, it's possible. I'm a FMG, completed MPS from Georgia, licensed in practice, but don't have a judging license. I'll have to go to judging, but please guide. Yes, I'm aware of the process in Georgia. I actually had a consultant who was from Georgia and a student, a Georgian citizen who was there, and he also had a issue getting his recognition because he told me Georgia blocks you from getting a license till you have completed your residency in Georgia. But he also had to repeat a year or two of medical school, and then they were willing to give him the license. So he's right now in medical school, clearing his school again. But if you have a license in India, there's a good chance that you will get the recognition, that will be able to get you the recognition. Like at least the base documents are clear, but we'll need to check it out. But it's definitely possible. Would it be possible to practice in India? So officially, as of right now, I let's see. Like I said, there's a alternate route. You can get a UK GMC registration. You can get a UK specialization registration, and that is recognized in India. If India directly recognizes the German this thing, I'm not sure because I don't really know anyone who has done it here and then gone back. But theoretically, yeah, that is possible. I'm from Kyrgyzstan. Yeah, so we discussed this. You had a really good scope as an orthopedic surgeon, but with the Kyrgyzstan, this thing, I told you there's a issue happening with the students there. So in this case, like I said, you fall into the high risk category, and I would then really consider how and what to do about it. So is NRB a good state to apply and for document processing time? Any online resources for med vocabulary? So NRB is a really good state. That is where we are from, and it is the biggest state with the most number of foreigners. And I would say personally, also a very friendly state, and has a lot of job opportunities here as well. And the processing time and all, you go to any state, it is going to take time, and it is yeah, if you compare it to Bayern, or if you compare it to um, Niedersachsen or so on, the time is almost the same that takes in those states as well. From where one should get German language course, any affiliation needed. So the thing is, any foreigner in any country, all of them, as far as I know, have a Goethe Institute in their country, and you have to have the language exam or the certification from a certified Goethe Institute. Other institute certifications do not count unless you're in Germany. Then that's a different story. So I'll just hand over to Rutuja.
If my MBBS is already recognized as equivalent, do I still need the KP and what am I? I think we already discussed the same question about the nuclear medicine as well and about the equivalency as well. Maybe we can go to the next one. My wife is a PhD student in Keln. Should I go through spouse visa and complete my B2 and FSP there? Currently on my A2, or should I complete my B2 here and then move to Keln for FSP preparation? So both pathways are possible. If if you already have your spouse visa, it is possible you can come here and finish the B2 and then later on give the FSP. Both are possible pathways, and honestly speaking, both are doable. But if you already have applied for a spouse visa, then I would suggest you can first come here, finish your B2. And one advantage about that I would say is that if you're already in the countries, then learning the language is much more, um, you grasp the language much better. So if you have the possibility of getting a spouse visa earlier, then I would definitely suggest that you can come here and first start on that. Yeah. Then let's move ahead.
One more thing, what I would want to add to this is my personal recommendation is go for the spouse visa, because once you are here, like Rutu just said, you can learn the language faster, better, and secondly, we have a very good option that we can get your FSP and KP recognized and funded, and here we can help you save around 8 to 10 lakh rupees. So if you want to know more about this process, just contact us. We'll be sharing our contact information at the end of this, the next slide, and you can just contact us, and then we'll let you know the complete details and how to go about it. So do I need home country registration for Georgia? I think you are from Georgia, Dr. Somya. Let me just check. No, like I said, depends on your country. If you are from Kyrgyzstan and from China, then yeah, you will need your home country registration. Also, I wish to pursue and specialize in orthopedic surgery in Germany. How do I go about it? My name is Dr. Hayden. Dr. Hayden, like I said, with your Kyrgyzstan degree, obviously we can guide you through all the process. But like I said, have been doctors who are having problems from Kyrgyzstan, so there is no guarantee that after doing the whole process you'll get a recognition. Dr. Gaurav, again, I have 4 years of clinical experience in casualty, OPD, forensic medicine, clinical care coordination. How will that help in residency? So that is a really good amount of experience that you have. So like I said, it depends. If you are going for something in those fields that you have worked in, so there's a chance that your post graduation get it reduced. Or alternatively, let's say now you decide, no, I want to do general surgery. So these 4 years of experience, whatever is possible, we might be able to get you a salary bump from level 1 to a level 3 or level 4, which is around from 5,000 to maybe like around 6,000 euros a month salary. I'm a graduate from Philippines, registration India, but on another website, my university is showing plus minus signs. How will that affect it? That I will have to look into it. What is the plus minus sign they mean? Uh, in the best scenario is you can just write to the medical council and ask them about it, and they'll let you know. But this thing I'll have to look into it. What do the both signs means? I think generally in this case, yeah or the no, we'll have to look into it. Obviously, if it is a negative, then there won't be an option to get your apply for KP. Then there might be a question that you need to either repeat few years in medicine here in Germany or completely reject everything. So, can we take any money clinical course such as MBBS, healthcare, or hospital management only if you are interested in it, or else it's a waste of money? If you are interested to become a surgeon, I would not recommend wasting money on all of that. Hi, sir and ma'am. Can you please guide a little bit on how to choose a state to apply for deficit Bescheid? So, like I said, we generally recommend West or South Germany because we have seen those areas and they are really good. The people are good. East Germany is also a possibility. There are relatively a little more vacancy there, but obviously the issue is also that there's a reason there's a vacancy there because a lot of people don't like the standard of living or this thing or the complete life altogether there. So it's not to discourage anyone or to talk negative about East Germany. It's just my personal opinion. But coming back to this thing, if I have to get for my post graduation, if I had gotten somewhere in a good hospital in East Germany, I would have definitely gone for it. That would have been a factor for me to stop also. I'm an anesthesiologist working in India, started learning even after completing BTech. What kind of visa? Like I said, you have the option of 16D visa. And can we prepare for FSP? Obviously, you can prepare for FSP. Just open any AI and tell it to teach you FSP, your medical terminology. Open YouTube and start learning what organs are called, what are all the medications called, and definitely you'll be able to start learning as soon as possible. And this goes out for everyone to everyone. Just look into it. It feels overwhelming, it feels difficult, but it's really doable. When I first myself looked into it on YouTube and on all other sources, I was really surprised. I'm like, oh, this is 50 to 70% is the same terminology, we just pronounce it differently. So MBBS from Belarus, 6 years, including inclusion, no Belarusian, but I have Indian registration. For Germany, is home country license enough or study country mandatory? Like I said, it depends on country to country basis. But from Belarus, I've not heard any issues, so that would be a good possibility there. How long should I stay in Germany for my FSP exam? How to choose a state if chosen? How to contact the state authorities in case of doubts? So obviously we guide you through all of this also. Then you don't have a headache to find all of this. But how to stay in Germany, how long? It depends on your FSP exam and which state you are in. So like for example in NRW, now my student came I think around 4 months ago, 3 to 4 months ago, and then she did her course, which was 3 months, and then she gave the exam. For the exam, she had to wait another month, and I think in overall, so 4 to 5 months. You can expect in NRW, and it depends on the state. Some states take more time to give you the exam date, so that is why also you have to find the right balance. You need to know in your state how long, number one, how long is it taking for people to get dates. So it changes. Now when I was there, I knew if I submit my application, I'll get it in the next month. Right now I know in NRW that in next 2 months you will get a date, but it changes. It could be that in the next 6 months that you're here, the rules have changed and the dates, or there's a waiting period, or it's gotten faster. So depending on that, you send the application for FSP so that you are firstly prepared for the exam, so that it's not too early but also not too late that you have to wait 6 months. So I'm an MBBS in intern in India, started learning A2. I want to pursue oncology. What is the pathway of specialty? So the pathway, like I just discussed in detail, you will need to finish your B2, then you need to get your if you finish your internship and your B2 along with it, that would be optimal. Nothing like it. And then you apply to the medical council, get your deficit Bescheid, get your license, all the process. Like I said, I'll just turn the slide for you. If you are now listening and are online, these steps apply for you. You can take a screenshot or a photo. Then I'll just move on to the next one. So I'll just keep it for students who are here. So how to prepare for medical German from the get-go? Again, we've discussed this. There are online study materials, YouTube, AI, and so on. And then once you have finished your B2, then we can also give you some textbooks and all of that from where you can study. So right now, if you're just looking into it, best go into YouTube and AI. So, looking back at your journey, is there any certification, research, or skill you think you would have given you an edge while applying in Germany? Not really. I would say, yeah, that one, if I had the real correct guidance, maybe it would have saved me a year. But I think that's something that I have to accept. That was how it was. But rest of the things, that is how it all turned out to be. If there was no delay, if there was no obstruction, I would not have done the hospitation in neurosurgery, and maybe I then wouldn't haven't gotten neurosurgery. So I would say no, not really. But I think here Rutuja can say that makes a huge difference in her case from how she did it. So I'll just hand it over to her. But just before that, for all the students who are here, we have a special offer. If you register with us in the next 7 days, you'll get a 10% off on the plans. To know more details about this, you can contact us. You can directly send us a WhatsApp or email us or on Instagram as well. And I'll just hand over to Rutuja because I think she'll have something important to say in this case, especially for people who are interested in dermatology or, for that matter, high demand fields like radiology, dermatology, and so on.
So, yeah, in normally, if you want to get into any non-competitive field, it does not matter. It's possible. But if you want to get into high, what do you call the high-end specialty fields or more fields which are more competitive, like radiology, dermatology, ophthalmology, neurosurgery, then it would matter definitely, I would say. Even in the case of urology, that would matter. And by certification, research skills. So I can right now explain from my field point of view. So certification, you can have multiple courses in aesthetic medicine, skin cancer surgeries, or research or thesis in the fields. And as well as for me, having that junior residency experience in the university hospital was really, really a game changer, because in dermat it's very difficult as what do you call it, as a foreign doctor to get into. And if they see it on the paper that there is a lot of experience in your CV, then it definitely is a additional plus point for them than hiring someone who doesn't have a experience at all. And so if you're in India or in your home country, and if you have the possibility to at least get some kind of experience in your home country in your desired field, please go for it. What I did in my personal journey was I studied my language, and alongside, after my internship, I worked as a junior resident in dermatology. And I worked alongside, I tried doing a little bit of research in the university itself, and I put all of that down in my CV, and it definitely helped me. The second point is I realized that without having that experience on paper, it is going to be very difficult to get into it. So even after coming to Germany, I decided not to stop. I kept relentlessly applying for as many as hospitations as possible in Derma. And like, it's like after you send 100 applications, to people answer you back. So it is that competitive. But that that's something that where we come into play. We help you uh, accordingly to guide you whichever field you want to get into, how you get into these hospitations here, what kind of letters you send to the hospitations, how you prepare your application for the hospitations. So that's what we help you prepare, so that you get into the field of your choice. It is obviously not 100% guarantee, but that is something which you can definitely add to your CV to increase your chances to get into the post graduation of your desired field. So I'll definitely suggest that. Yeah. So maybe we can move ahead. Typical working hours for an internal medicine resident per week. So, medicine anywhere in the world, we have to work a lot as doctors, but in Germany, uh, they have fixed working hours. It's mostly 40 working hours. But if you're working in a hospital, then you have to take over call duties, which is everywhere in the world the same. But the good part is in Germany is that these call duties are paid extra. It is not included in your base salary of 40 hours of week. So it depends on your hospital, on the number of doctors who are working in your department, how many call duties you do in a month. But usually one does around 4 to 6 call duties on an average in a month. But apart from that, the working hours are 40 hours per week, if that is what your question is. As Rutusha ma'am said, previous experience in a particular field helps securing that position. So, how do I build my work experience? Exactly what I said right now. I think that must have already answered your question. So, yeah, we can go ahead. I have no postgraduate internship, but I have Indian medical license of. Okay, I think the question is okay of. I have 4 year MD degree from Philippines. I have Indian license, but no postgraduate internship. Fourth year is clear clerkship, which is hands-on training. I guess this question was repeated, but if you have your Indian license, it's okay if you don't have your postgraduate degree, but you can come here and apply first for your recognition of your license, the approbation, and after that apply for your PG. And during that, whatever post graduation experience you have, one can try getting it recognized by the medical council. It depends case to case scenario, but one can definitely try getting it recognized. So it's okay. As far as you have your medical license degree, you can definitely apply here. So yeah.
I'll just look into it. I think MD degree, do you mean your medical degree from Philippines and you don't have a internship, you have a clerkship? Is that what you mean? Is that the short form for MD, or what is the case? If you mean medical degree, yeah, then medical degree, but you need an internship completion certificate. So that internship completion certificate from India, yeah, that would also work because a lot of people have that. So you need your MBBS degree or your medical degree in this case, if that is what you mean, and you need your internship completion from India, that also works, and your Indian license. Then. So, do you know which documents to start working in Germany as a EU graduate? So, the documents remain the same. You just have to give the FSP exam as a EU graduate. And once you clear that, then you get it. But the document process remains the same. You need your degree, your license in your EU country. Um, you need your internship completion certificate, your curriculum of your university, and so on. So, you can just check them out on the HTechMR website. Okay, this is a repeated question. Should I need to translate my experience certificate in German? Yes, you need to get it translated in German. Anything and everything that you have, you need to get it translated in German. And especially what we do is, so now your post graduation has a thing called as a logbook. So in that logbook, every post graduation has certain criterias that you need to complete to be eligible to apply for your post graduation. So what we generally guide our students is through this logbook, add those points if you have done it in your home country. So let's say you're working in Dubai there, and you have experience in outpatient department. You have experience in maybe doing outpatient stuff. I don't know, like any kind of thing, like maybe any specialty that you are doing it into, in diabetes, in hypertension, and so on. So in those cases also, those criterias we can specifically extra mention that you have specialized in that, or you have experience in that. Or if you're working in a hospital, so you have experience in wards, you know how to suture, you know how to put a central line, you know how to put a vigo, and so on. So those things, which we create in such a way that there's a good chance for you to get recognition money wise, and in a good case scenario also for reducing your post graduation time. After graduating in China and practicing in India, I have GMC registration. Would this help? Yes, that would definitely help, because a GMC registration, then you fall into, because since UK was a part of European Union until recently, until a few years back, until Brexit happened, they did recognize all GMC registrations. So in that case, there is a possibility, unless your China university is not in the Annabin recognition center, then there might be an issue. But I think if GMC is recognizing it, there's a good chance that you will have get recognition. Rather, you might not also have to give the KP exam, you might just directly get it with an FSP exam. But like I said, every student is different, every scenario is different. So you will have to apply and see how it goes. So if you are already in, let's say, in your B1 B2 level, then I would definitely suggest that immediately apply, and we can see what they say. But there's a good chance that you might not even need to give the KP exam with the GMC registration. You just have to give the language exam, which is honestly a piece of cake. If you can clear out MBBS final year exam, the FSP exam is like literally a piece of cake. So, what are the cost of your MedZiel services? So, we'll be sending you out an email after this, and in those emails, and like I said, here's a special offer as well. You can contact us over the emails. We have three different packets that we offer depending on how much support you need, and this all we can discuss over a one-on-one call. We generally prefer to know what our students want, how is their plan, and we'll be honest with you. We are not going to lie to you, we're not going to make you dream about something that we cannot promise it to you. Like, I'm saying it clear to people who are from China or from Kyrgyzstan, that I'm sorry, I am not really 100% sure if I'll be able to help you. That is why I always want to talk to the students first, see what their plan is. And if I know I can definitely help you out, then we go into the stage ahead. And because we are not someone who want to make false promises and, delay your life or scam you into anything or give you false hope. If there is not a possibility, I'll just tell you, I'm sorry, this is not possible. It's not going to happen. So depending on that, we like to personally discuss everything and then make a decision. With regards to CV, any specific things you need upon for getting approbation or getting into specialties? Like Rutuja already said, the more experience you have, the better it is. So it's like a double-edged thing. You'll be like, Abhi, internship, I need to learn German also, then I need to work more also. Obviously, if you are aiming for something like dermatology or something, the more experience you have, the more international research you have, the more conferences you have attended, the more you can show on your CV, the better it is. Now, for example, I'll tell you, we have a neurosurgeon from Ukraine. He had 7 years of experience working in Ukraine, and he got a job in immediately because he was already a specialist with good experience. And they were like, you have cleared your FSP, we'll wait till you finish your KP, you can do your repeat your residency here and everything. But they had a good CV, so obviously that matters a lot. Okay, this is again repeated. Is it difficult to get your approbation in Berlin compared to other cities? So Berlin is like the biggest and the most international city. From what I've heard, no approbation. Getting your approbation in Berlin is, I think, from what I've heard, a lot of students prefer that because the examiners there are also quite open to everything. And Berlin in general is a as an international person, if you're not that strong in German, it's also a good place to start in. But no, there's no such thing as it's extremely difficult in Berlin compared to other cities. Like I said, your approbation exam is just like your final year medical exam. If you could clear your final year medical exam in your home country, in your study country, wherever, you can clear the approbation. There is absolutely no need to worry about this or that. Honestly saying, from my personal opinion, the people who did not clear their approbation, I was there in the exam. One person did not clear the approbation, and honestly saying, the way they answered in the exam, the way the medical part, what they answered, forget the language, just the medical part that they answered or weren't able to answer. On that opinion, if I was the examiner, I would also not have passed them. And I also know a few colleagues here and there who did not clear it in their first attempt and so on. And when I practiced with them, so I had a feeling that this person was not ready for the exam. Obviously I didn't want to discourage them and all of that, but then personally I feel if you can clear your MBBS medical exam, you can easily clear your approbation exam. The difficulty level is the same, and yeah, and it is very easily doable irrespective of where you do that. Like now in NRW, they say it is the most difficult exam. Me, Rutuja, Nigel, we all cleared in our first attempt. It wasn't, and honestly saying, we also had the same feeling that no, wherever we had to study a lot, obviously, but it wasn't like it was something different from your final year medical exam. I think Rutuja can add a little bit to it.
So, yeah, that is one thing. A lot of people ask me also, if you have to give the exam in NRW, there is a lot of failure rate of students there. But honestly speaking, if you know your basics, then you will clear the exam. It's as simple as that. And what we do at MedZiel is, I want to add on it, is that during your approbation or your KP preparation, we need to see which state you're giving your exam in. What are the common questions asked in those states? How do you study for that? What are the protocols for those exams? All that things is something that we come into play and we will be guiding you with. So it's very important to know that clearing the exam is not difficult if you exactly know what to study, how to study, how to answer those questions, what kind of questions are going to be asked to you, then it's definitely possible. But the main thing is if you know your basics, because what they are going to test is that you are not going to kill a patient. All they need to know that is you need know your basics and you know what you have studied in your medicine. Obviously the language plays like a huge role and it is important, but you need to know your basic medical, um what you say, the information as well. And then definitely it's doable, irrespective of whichever state you apply to, it is doable. So yeah, maybe we can move ahead. Yeah, like Faiz mentioned, we will be getting a recording of this webinar and on the mail you will be receiving it. So ahead.
Like I said, I've also displayed the this thing here. You can see that. Just a second, I'll maybe just remove this, so you can see on the screen as well. Here's the link as well on the screen. You can just check it out. It's the same link that you got for YouTube. You can anytime open it and then check this webinar again, and all the discussion that is there, it's always saved and available for you guys. So Georgia,
So
what about we get internship, JR doc certificate, but do I need home country license? Yeah, you need a license. Also, like I said, you need a license either from Georgia or from India. But if you have a license in India, then it is good. But if you don't have a license in Georgia or India, then you need to get one. Are there any state you would recommend? Like I said, I have not. I'll be honest with you here. Um, I know myself. I know personally a Chinese FM guy, the doctor who's from China, FMG there, and she's done everything here, and she had didn't have a lot of issues. So this is the state in NRW, but I've heard online a lot of discussion happening that they are not recognizing it, or there are some issues and all of that. One student had sent me his rejection letter, and that was he was trying to get direct registration recognition without the KP exam. So that was the rejection. But I wrote honestly saying don't know for sure, and that is why there's been a lot of online discussion with a lot of people saying that there is a possibility that they can get rejected. So unless you're already in your advanced stages, I would recommend really look into it. Or if you are coming here as it is through some other visa, or you are already in Germany, then it's a different story, then you can obviously apply. But if you have not yet started, then really think about it, because there is a chance that there might be an issue and all of that. And the issue is you can try mailing the medical council for this if your recognition is there, and they might answer you. But from experience, what I'll tell you, they'll just tell you, yeah, submit everything and then we'll look into it. So, can I study B2C1 in Germany after B1 in India? Yeah, that is not possible. I tried this myself, and in India, they do not give you the visa until you have completed your B2 and have a Defizitbescheid. It is possible if you come on a job search visa, but then again, a job search visa is an extra expense and all of that. But yeah, if you go on a job search visa and you have the funds for it, then that is possible. Then you could do that. So, will MedZiel help in KP preparation? So, we do not take classes ourselves, but we guide you. Like I said, we guide you to classes which are good and which we have personally attended as well. And most importantly, classes that get government funding. So, a class for, let's say, FSP and a KP class, they cost around 4,000 euros, which is around like 4 lakh rupees. And each class, there's a possibility to get it funded. There's no guarantee, obviously, but most of our students get their classes funded, especially the KP class. There's a very, until now, all of the students have gotten their KP classes funded, which is like 4 lakh rupees that they have saved. So, apart from that, also the tips and tricks and all of that, obviously, we guide you through all of that for the KP preparation. So we are, like I said, A to Z, from point one, from when you start learning German till you are working, till you are here in Germany. We are there to guide you through it, and we don't have a hard and fast rule. Okay, that it's done now. Goodbye. We don't want to talk to you. We would love, and we are in contact with all of our students as well. They always keep updating us if they have any issue, even later on in life, or if they need some guidance, and so on and so on. We generally help them out. We are in touch with them. So it's not like a hard and fast that we do only this and that. Can you get sponsored by a relative and avoid blocked account? Yes, that is correct, and that is a very good point. If you have a relative or a family member there, they can give you sponsor you, and then you can avoid the blocked account cost. Is home country registration required? If, like I said, you need a country international, you need a license. It can be from India, it can be from Philippines, but you need a license. Also, do we need to get a degree apostille from the German embassy in Philippines particularly? It depends. If you are living in India, you can get it done in India as well. Your documents, yeah, the documents that are in Philippines, I think that you need to get it done from the German embassy in Philippines then. After C1 in Germany, should we wait for FSP, or can we do part-time job courses? So courses are not there. Pflege courses are not meant for doctors, and you can work part-time as soon as you arrive in Germany. You will, on the visa, on the 16D visa, you will get a work permit as well to do part-time. Rutuja also did it when she arrived here. So she was working in a hospital part-time, and making some money also before FSP as well. So there are a lot of possibilities, even in clinics and in hospitals, where as soon as you arrive, you can start working uh, in as a part-time job in other medical related things which do not require a license. So yes, that is possible, and we can guide you through all of that as well. How is state of Saxony? Beautiful. And yeah, medical wise also, I myself had applied, no, Saxony, no, that was neither Saxony. Saxony is actually quite good. It's but it comes under the eastern part of Germany, like I said. So if you know a family member, definitely go there. If not, also the job opportunities are there also over there. So yes, I would say anywhere and everywhere is okay, as long as you have friends and family around. Because trust me on this, it's a huge factor, having someone, a support system nearby around you. Is it possible to get a hospitation right after graduating med school? What are the requirements? No, you need to learn language. For a hospitation also, you need to have at least B1 or B2 level language. Once you have that language, because there's no point going for a hospitation if you cannot understand what they are discussing. And they will not have the time, especially in neurosurgery, to tell you what is happening and what are we doing. They'll just make you sit in a corner and you won't be achieving anything out of that hospitation. So no, you need to learn German and then you can do a hospitation. How hard is to get your desired specialty in Berlin? Extremely hard compared to other states. So now, like I said, Berlin, you have options in 1 hour radius. You have multiple options. You can live in Berlin and then apply in the nearby areas. And once you have more experience, you can move to Berlin. But as a beginner with zero experience, directly fresh from medical school, the chances of getting in Berlin, unless you go for internal medicine or general surgery, are difficult. I would say they are not impossible, but they are difficult because it's like a big city, so it's a little difficult. But in the 1 hour radius of of Berlin, there are a lot of other places where you could apply and still live and work, still live in Berlin. Regarding the sponsorship, you have relatives from any other country of EU, right? Or do we take visa from Germany? Only German. You need your relative needs to be from Germany. They need to be living in Germany to show that. I don't think they accept EU country. And I obviously you need a visa from Germany. If you take a visa from somewhere else, that visa will only be a support visa or this visa, and then it just complicates everything for you, because then they'll be like, you're doing a scam, you're going there and then you're coming here and all of that. So you need to get a German visa, and best scenario is obviously that the person is here in Germany. And for hospitation, I mean, if you have B2 level, what are the other requirements? If you have a B2 level, you can directly start applying, even from your home country. I applied from India. I was sitting in India. I was sending 10 applications a day. I think I remember I sent around like 200, 300 applications. And then finally one clicked and they called me. But I was not specific about neurosurgery. But yeah, like I said, 17, and then there are a lot of states. So you have like maybe you can easily send 150, 200 applications from your home country, wherever you're sitting in India or wherever you are. And it is possible to send for, with B2 certificate, it is very easily possible to send for hospitation. And then you can come on a Schengen visa here for the hospitation, get an idea how it is in Germany, get to know the process, and then make a decision if you want to come back or no, or so on, or if the state that you like. So I would suggest, if you have already have a state in mind, just go for that state, pick that state, apply for hospitations in that state, um, and then you can do it. No, please remember, anybody asking you to pay for hospitation is a scammer. Do not pay for that. Hospitations are free of cost. It has always been that way. Rather, before it was a trend that for hospitations they also used to pay for you. Sometimes if the clinic is nice, they might even give you free accommodation or free food. But no, never pay for hospitation. So that was our last question. I think we have all of it. I see there are still 10 users. And if you have any question, this is your last chance. Or else, please contact us here and then set up a call. You'll also receive, or maybe probably have received, an email from us regarding what is the further process to contact us, what are the cost and all of that. and then through all of that you can visit us, and you can check out our YouTube channel. We have posted all of these content also in detail over there, and so on. Okay, good. So I don't see any more queries coming in, so I think that would be it. So it was really nice talking to all of you, and we'll continue this. We'll keep doing few more webinars. So follow us on Instagram as well, and so that you can register for further webinars as well.
Thank you, everyone. It was really nice to answer all of those questions. Like Faiz mentioned, contact us whenever you want. And yeah, we can surely make things work through for you guys.
Okay, goodbye.